Hello everyone, this is Dr. Rituparna Ghosh. I'm a consultant clinical psychologist with Apollo Hospitals, Navi, Mumbai. Today we are going to discuss a very important topic related to mental health and the clinical aspect. Yes, bipolar disorder. But before that, I would like to tell all of you that in today's world, because of too much information we gather from Google, even a small mood swing or even an abrupt mood swing is termed or labeled as bipolar by people. So if a person is feeling sad for a short period of time, we tell that person you are having depression. Similarly, it happens with bipolarity or this label. We need to understand that just a mood swing for a day or two is not a bipolar disorder. So now let's see what exactly is bipolar disorder. So in bipolar disorder, it is basically characterized by frequent, abrupt and recurrent mood swings, starting from depressive lows to manic highs. So there will be a constant shift in the mood and that will occur quite frequently. So at one point of time, the person might feel very depressed, low, there's too much of sleeping, lack of appetite, inability to derive happiness in life, loss of interest in activities, crying spells, sadness, lack of motivation. And at the other moment or the other point of time, the person may feel very high on mood, elevated mood, increased talkativeness, lack of sleep, overeating, speaking of big thoughts and plans, which we call as megalomaniac plans, too much of shift in ideas very abruptly. At the same time, too much of spending, risk-taking behaviors. So it's a complete opposite, but a total swing of two extremes within a very short period of time that the person will experience. That's why it is called bipolarity of mood. And this particular diagnosis can only be done by mental health professionals. So it can be a person can be told as having bipolar disorder only after a proper clinical diagnosis. The treatment continues for a prolonged period of time with proper medication and supportive psychotherapeutic intervention. The causes can be a lot of factors. There can be genetic and heredity factors, there can be environmental triggers, and there can be some neurochemical imbalance in the brain as well. Now coming to the treatment part. Of course, the first thing is medication that are prescribed by psychiatrists. Mostly mood stabilizers are given, along with supportive psychotherapy being done by clinical psychologists, wherein different types of therapies are used. For example, we can use cognitive behavior therapy, wherein the person is helped to identify the negative thoughts, beliefs, emotions, and the actions and how to work on them and how to substitute them into positive thoughts, feelings, and actions. Also, therapy helps to identify the triggers that lead to such bipolar episodes and at the same time to help the person to deal with stressful life situations in a productive and constructive manner. At the same time, a lot of lifestyle modification is needed. Proper sleep, proper diet, exercising, practicing and nurturing hobbies, and a balanced lifestyle. At the same time, psychoeducation of the client who is suffering from the disorder. At the same time, family members and friends to understand the exact nature of the problem so that even if there's a trigger that leads to such bipolar episodes later can be identified by the family and they become cautious to prevent further relapses. So psychotherapy, lifestyle modification and psychoeducation, everything goes hand on hand with proper medication to work on dealing with this disorder. So, for all of you, it is important to understand that bipolar disorder is only diagnosed by a mental health professional and treatment is possible provided the person complies to it. It's a long-term treatment, but you can definitely deal with it and lead a happy and productive life. Thank you.